Hi everybody, Dr. Repac here from Vet Triage. We are going through this issue of veterinary surgery, just starting it. It is from February 2022, so not too far off. And we are going to be talking about a systematic review of postoperative rehabilitation intervention for cranial cruciate ligament surgery in dogs. Study comes out of AMC from New York City, University of Florida, a rehab center in Washington, and a specialty center in Washington. And for those who are interested in learning more about cruciate disease, down here I have my YouTube channel. I've got 4 parts talking about cranial cruciate ligament disease in general, so feel free to watch that. And and there's other cruciate talks. Obviously, this orthopedic condition in dogs is probably the most commonly published, researched, investigated orthopedic condition in veterinary medicine by far. So the objective in this study is to critically evaluate the evidence for rehabilitation interventions following surgery for cranial cruciate ligament disease in dogs. It's a systematic review. They use Google Scholar and PubMed from 1990 until March 2020 to look at these different studies. Results found that 19 studies fit the criteria. 12 comprised random controlled trials, which are considered level 2 studies. 6 were non-randomized or non-blinded, so level 3, and 1 was retrospective, which is level 4. 16 studies out of the 19 yielded positive results. Therapeutic exercise had the most studies with positive results. Cold compress were supported by 3 studies. Extracorporeal shockwave was supported by 2 studies. Photobiomodulation supported by 1 study. A negative outcome was noted in 1 photobiomodulation study, and then there was 1 study on electrical stimulation and no studies on low intensity pulsed ultrasound. So clinical significance, there is a lack of class 1, which is considered the best class. Class 1 level evidence in veterinary rehabilitation. And just to show you this is the chart they're using to describe the different levels of evidence. So you can see there, class 1 is evidence derived from multiple randomized blinded placebo-controlled trials. 2 is evidence derived from high-quality clinical trials using historical controls. 3 is evidence derived from uncontrolled. And then 4 is evidence derived from expert opinion or otherwise. Introduction. Cranial cruciate disease is the leading cause of hind limb lameness and stifle osteoarthritis in dogs. TPLO, TTA, and extracapsular techniques are most commonly performed. It's an estimated 70 to 71% of veterinary practitioners refer patients for postoperative orthopedic rehabilitation. Modalities such as laser therapy, also known as photobiomodulation, and hydrotherapy are commonly considered as part of rehab. Materials and methods. The key terms they use to search for these papers include cranial cruciate ligament, canine, tibial plateau leveling osteotomy, postoperative rehabilitation, or physiotherapy. The categorization of results included exercise, which also included in that category swimming, underwater treadmill therapy, land-based exercise. The other category is cold compress therapy, then extracorporeal shockwave therapy, photobiomodulation, low-intensity pulsed ultrasound, and electrical muscle stimulation. Results found that 19 papers met the criteria. 12 out of the 19 were high-quality clinical trials, and 16 yielded positive results, meaning in support of rehabilitation. So in terms of exercise, the papers that looked at exercise, a study by Morzolias et al. Performed a prospective controlled clinical trial, rehabilitation versus activity restriction after extracapsular repair. Rehabilitation included swimming, passive range of motion, therapeutic walks, and massage. Peak vertical force and vertical impulse were greater for those dogs that received therapy. In the next study by Morzolias et al., extracapsular repair compared with healthy dogs using a swimming protocol, they found increased tarsal and stifle flexion in that study. The next study looked at by Monk et al. Looked at rehabilitation compared to a home exercise plan in dogs recovering from TPLO. Treatment included passive range of motion, massage, underwater treadmill, and functional weight-bearing exercises. They found that circumference and stifle range of motion were larger. A study by Jerry et al. compared home exercise versus swimming and electrical stimulation therapy in dogs with extracapsular surgery. Another study by Romano et al. Looked at rehabilitation after a TPLO, and they found that more likely to achieve functional outcome at 8 weeks with rehabilitation. A study by Verpalen et al. And Balzer et al. They published 2 studies on rehabilitation, omega-3 fatty acid supplementation, and protein-enriched diet in dogs after TPLO. They found that a greater peak vertical force, lower pain, lower lameness scores, increased activity levels, decreased progression of arthritis. Dogs fed supplemented diets with or without rehabilitation had higher peak vertical forces, vertical impulse, lower levels of prostaglandin E2, and slower time to complete osteotomy healing. Now, in the studies looking at cold compression therapy, Rexing et al. Looked at cold compression therapy with microcurrent electrical therapy and bandaging applied after extracapsular repair. They found that cold compress with or without bandaging and microcurrent electrical therapy with a bandage reduced limb circumference after 74 hours was found. Drygas et al. Looked at TPLOs with cold compress therapy. They found a low visual analog and Glasgow pain scale scores, lower pain threshold scores, decreased stifle circumference, increased range of motion in the first 24 hours after surgery. No benefit was detected after 14 days. Keeves et al. Looked at cold compress therapy, bandaging, and compared cold compress therapy, bandaging, and then cold compress with bandaging following a TPLO. They didn't find any differences. Von Frieden et al. Looked at 2 different cold compression therapy protocols, so using a cold compression device with a pump model in dogs that had TPLO. They found that with cold compress, greater stifle range of motion, lower Glasgow pain scores 24 hours after surgery. After 10 days, both cold compression groups had lower lameness scores compared with the control group. 42 days after surgery, range of motion was greater in both cold compress groups compared with control. There was no differences in outcome between cold compress groups at any point. The next category was extracorporeal shockwave therapy. Gallagher et al. Looked at shockwave therapy on patellar ligament desmitis in dogs with TPLO. The mean patellar ligament thickness measured radiographically was found to be lower with treatment. Barnes et al. Looked at extracorporeal shockwave therapy on osteotomy healing with autogenous cancellous bone grafting in dogs following a tibial tuberosity advancement or TTA. At 4 weeks, this therapy with bone graft demonstrated higher osteotomy group gap density compared with no treatment and with those only receiving shockwave therapy. Barnes et al. Looked at shockwave therapy in 16 dogs after TPLO. No difference in osteotomy healing. However, in the dogs that received the shockwave therapy, they had greater peak vertical force and vertical impulse than control dogs. Thigh girth, pain scores, and goniometry were not different. The next category is photobiomodulation. Rogatko et al. Looked at this treatment with TPLO dogs, and they found that peak vertical force was greater with this treatment. Renwick et al. Performed the treatment in dogs undergoing TPLO, and they used an adjusted canine orthopedic index score and found improved subjective outcomes with this gait. The score analyzing the gait. Kennedy et al. After TPLO didn't find any differences with this therapy. Next category is low intensity pulse ultrasound therapy. Keeves et al. Looked at TPLO dogs, didn't find any differences. And the last category is electrical muscle stimulation. Johnson et al. Looked at extracapsular repair. Dogs with electrical muscle stimulation had larger limb circumference, decreased radiographic arthritis scores, lower lameness scores compared to controls. There was no difference in ground reaction forces and stifle range of motion. Discussion. In support of exercise-based therapy for dogs recovering from cranial cruciate ligament disease surgery, however, most studies had a high risk for bias. So although there was overall positive support for this type of rehab, it seems that a lot of bias is in these studies as well. Formal exercise-based rehabilitation programs in dogs after cranial cruciate ligament disease surgery supported by 6 of the 7 exercises in this review Overall, exercise interventions showed benefits, but there's a wide range of exercise techniques, and further research is indicated. In humans, exercise therapy is the mainstay of evidence-based rehabilitation therapy for managing anterior cruciate ligament rupture. And in people, they have a multi-center orthopedic outcomes network, or MOON, that has guidelines for rehab. Thigh girth has also been shown to have high intra-observer and inter-observer variability in animals. There is currently no evidence supporting other types of extracorporeal shockwave therapy, which include electromagnetic, piezoelectric, or radial for postoperative cranial cruciate ligament disease. So yeah, overall, I mean, good study, obviously limited by what keywords they used. And, they said in this paper too that they found like over 300 papers that referenced it, but it didn't fit their criteria for rehab. The other problem that I have with papers like this is like, we know, even from people, folks who are listening and watching this, who've had rehab done, it does help. And any veterinarian, I think, would say anecdotally that in their experiences it helps. It at least doesn't cause any harm. But it's just a complex thing to study. And I wouldn't write off physical therapy in general just because there is no basis for a lot of it, although I agree that we should be following the evidence. But at the same time, we know that it doesn't really hurt, so as long as the pet owners have access to rehab and they can afford it and the animal tolerates it and there's no obvious contraindications to it, then I don't see a problem with recommending it, even though there's not enough evidence basis for it. So anyway, that's it for this one. We'll see you again in the next video. Take care.